check, check, 1, 2. Mic check, check, check. All right.
Good afternoon. I'm Michelle Brooke, City of Tulsa Communications Director. We'll get started here in just a minute. I just wanted to lay out who will be speaking today. First will be Dr. Bruce Starr with the Tulsa Health Department. Second will be Mayor G.T. Bynum with the City of Tulsa. Third will be Tulsa Police Chief Wendell Franklin. And then fourth will be Tulsa County Commissioner Karen Keith. After we are done with all the question portion, we'll get into the question portion after the speakers are complete. What you need to do is address who the person is that you have a question to, and they will come up to the podium and they will answer and give a response. We have a lot of people here in the room, so just be mindful of that and keep your questions together if you can, instead of shout them out. That's all I have at the moment. And we'll get started with Dr. Dart.
Thank you, Michelle. I'm going to remove my mask so all of you can hear me, but wear your mask in public. Today at Tulsa County Health Department, we are reporting an additional 96 Tulsa County residents who have tested positive for COVID-19, which is a new record for a daily increase throughout this response. We have a cumulative total of 1,825 people who have tested positive for COVID-19 in Tulsa County. The good news around that is 1,166 of those people have recovered. Sadly, 64 residents have died. And please join me in sending condolences to their families. There are currently 595 confirmed active cases of COVID-19 in Tulsa County. So all along throughout this response, the Tulsa Health Department has said we follow the data and we make data-driven decisions. We provide robust information on Tulsa County cases on the dashboard on our website, including zip code, age range, and race of patients. We provide information to inform the community while protecting patient privacy. Early last week, we began to see a marked increase in the number of new cases reported daily. On our 4- and 7-day rolling averages, we saw that those began to climb as well. Unfortunately, we continue to set new records in the number of cases reported in Tulsa County. Since June 6th, we have seen a significant increase in hospitalizations. Hospitalizations typically lag behind infection reporting. The increase in hospitalizations is a trend that we are watching closely and gets updated daily on our website. I do want to add that our hospitals so far do have surge planning, and thus far their capacity has not been impacted so that they can't treat the patients that are coming in. From June 6th to June 13th, we reported a 116% increase in cases over the previous week. We also saw an average age of positive cases decrease to 36.2 years of age, with the largest increase in cases in Tulsa County in the 18 to 35 age group, the second largest increase in the 36 to 49-year-old age group. While the risk of severe complications is lower for younger people, they can spread it to those who are more vulnerable, and that's one of our major concerns. The Tulsa Health Department has been conducting an epidemiological investigation, including contact tracing for all COVID-19 cases in Tulsa County since the very first case was reported and confirmed on March 6th. We have expanded our contact tracing team to now include nearly 60 public health professionals who assist with case notification, contact tracing, and risk assessments for those cases. The team includes bilingual professionals to ensure we are meeting the need for non-English speaking individuals that we contact. We also have the ability to use a language line for translation services as needed. As all of you probably know by now, contact tracing is a standard public health tool to mitigate the spread of disease and stop infections. A representative from the Tulsa Health Department will call individuals and facilities that have been exposed to a confirmed case to assess risk and make a recommendation regarding quarantine and isolation of possibly exposed people in those facilities. We've had issues with scammers. If you get a call from anybody saying they're from the Tulsa Health Department, they will never ask you for money or your Social Security number. We are continually assessing capacity needs and have the ability to scale up by reassigning staff and utilizing the Oklahoma Medical Reserve Corps to meet the need for Tulsa County. My team, and I really want to be frank and honest here, has been working themselves to the bone on this response since it started in February. They're incredibly dedicated, motivated public health professionals who have been putting in long hours every day, 7 days a week, nonstop for months now. They do it because they care about our community. They are residents of this community too, And like us, we want to keep everyone in Tulsa and Tulsa County safe and healthy. There are a number of events and large gathering planned in our community this weekend. We want to keep Tulsa County residents and visitors safe. I have the same concerns as the CDC regarding large in-person gatherings, where it's difficult for people and individuals to remain spaced at least 6 feet apart, and attendees travel from outside the local area are the highest risk for transmission. Let me be clear. Anyone planning to attend a large-scale gathering will face an increased risk of becoming infected with COVID-19. Also, I want to be clear. We support everyone's American rights as Americans to assemble. We want to keep people safe. So if you are coming, here's what we ask that you do. If you're part of a vulnerable population, which includes those 65 years old or older or who are immune compromised, please stay home. Seek other ways to participate virtually. If you are sick or have recently been exposed to someone with COVID-19, stay home and seek out virtual ways to participate. If you attend, wear a cloth face mask covering correctly. The whole point of wearing this mask is to protect those around you. In case you are infected and don't know it, which is our biggest concern with asymptomatic spreaders, your mask should cover your nose and mouth, fit snugly against the sides of your face, and allow you to breathe easily. Avoid touching your face. The average human being touches their face 30 times every hour. Wash your hands with soap and water often. If those facilities aren't accessible, use hand sanitizer containing at least 60% alcohol. Be kind to those who are taking your temperature if that's offered at any gathering, or check your temperature beforehand. If you have a fever of 100.4 degrees or higher, seek out options to participate virtually. If you attend a large gathering, you should also monitor yourself for symptoms for 14 days and contact your healthcare provider if symptoms develop. Wear a mask to protect others in case you've been infected. People with COVID-19 have a wide range of symptoms reported, ranging from mild symptoms to severe illness. These symptoms include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion, runny nose, nausea, vomiting, or diarrhea. We have collaborated very closely with community partners to keep our community safe. St. Francis Health System, one of our local hospitals, has generously donated 40,000 masks to help in the fight to lessen the spread of COVID-19 in our community. Now that healthcare systems have had a chance to secure PPE for internal populations, including staff, patient, and visitors, they have also been able to secure masks from a supply that is separate from what they use for staff. Beginning Friday, anyone can visit Reesers, Rib Crib, or Catholic Charity locations to receive a free mask while supplies last. This is a great example of public-private partnerships working together to keep our community safe. We've had a lot of questions around where people can get tested in Tulsa County. There's many opportunities to be tested for COVID-19 in Tulsa County. Our local hospitals and healthcare systems offer testing to their patients. The OU Tulsa and OSU Center for Health Sciences also offer testing. There are several Walmart and CVS locations that offer testing. Of course, the Tulsa Health Department does as well. Our agency has increased testing several weeks ago, and we have received information on testing sites in Tulsa. We have information on our testing sites in Tulsa County on our website. I encourage everyone seeking tests to visit our website for a list of those resources. As a public health agency, our job is to provide the guidance and recommendations to keep our community safe. Tulsa County has done a tremendous job over the past several months to slow the spread and allow our hospitals time to prepare. Stay the course. And as I said before, I know so many people are over COVID, but COVID is not over. COVID is here. It's transmitting very efficiently in our community. Please stay the course. Follow recommendations. If you're in public, wear masks, social distance, pay close attention to hand washing and hygiene, and keep yourself safe and healthy. At this time, I would like to introduce Mayor Bynum.
Thank you, Dr. Dart, and never miss an opportunity at one of these to say how much I appreciate Dr. Dart and his team, the great work that they do in our community. I I think it is very important. We haven't had one of these in a while. I think it's really important to talk for a moment about where we are right now versus where we were in mid-March. We faced a situation there in early March where we had a new virus that had arrived in our community to which no one was immune. We were, just by luck of geography, we had about a week and a half of seeing how cities on the coasts handled the arrival of that virus before it really started to spread in our community. Our hospital systems, when I talked with doctors and physicians there, what I heard from them was that they did not have the protocols and the equipment in place to handle a virus like coronavirus when there was an entire city that wasn't immune to it, and there was real concern about that virus overwhelming our local healthcare system. There was a point when we initiated restrictions as a community where one of our hospital systems was down to less than a week of protective equipment for their staff. We locally initiated drives for companies and individuals to donate protective equipment so that we could give it to our hospital workers, because there was such a concern locally that they would run out and not be able to serve those most in need. There was a real fear about running out of beds. There was a real fear about running out of ventilators. And with all of that concern in mind, we recognized that we had to do something in this community which, to my knowledge, we have never had to do before, except in isolated instances in very localized geography, which is put in place restrictions on gathering, on how many people can gather, and eventually escalating all the way to shelter in place for our city. And we maintained that for over a month as a city. It is important to remember, though, that we did that not thinking that we would prevent anyone from ever getting coronavirus. The purpose of that and the purpose of flattening the curve was and is to slow the spread of the virus so that our healthcare system could build up the capacity that they needed. And in that time that Tulsans were making that great sacrifice, our hospitals and our healthcare providers locally obtained the protective equipment they needed. Most of the hospitals I visit with now have over a month's supply of protective equipment. They now have the protocols and systems in place to properly treat COVID-19 patients. The U.S. Army Corps of Engineers, thanks to federal funding in the state of Oklahoma, came in just across the street and refitted over 120 rooms in OSU Medical Center on 3 different floors solely for COVID-19 patients. And so where we are today is in a very different place than where we were in early March. The sacrifices that were made, when they were made to allow that healthcare system to develop the kind of capacity that it now has. And so when we talk about elevated numbers of positive cases, I share Dr. Dart's concern about those. And those are absolutely something that we need to continue to monitor and take very seriously. But I'm also cognizant of the fact that when you look at our overall hospitalizations, the very thing that we were concerned about in March, the latest number I saw was that we have 30 Tulsa County patients who are hospitalized with COVID-19 right now. Over the weekend, on Sunday, in the 120 beds that we have at OSU Medical Center for COVID-19 patients, we had 3. And so our capacity to handle the long haul of this pandemic remains very strong. And I think that's incredibly important for the citizens of Tulsa to know. Your sacrifice that you made to build up that capacity is what is allowing our reopening process to continue. And we began this reopening process knowing that the numbers would increase. It is only logical that as more people get out and about and get back to our daily lives, that we should expect those numbers to increase. But the key thing is to maintain that hospital and healthcare system capacity to be able to treat those most in need of assistance. I want to talk a little bit about, what I see in the rising numbers. I think it is notable that we've been in a reopening process statewide in Oklahoma since the 1st of May. And we're now in the third phase of that, each phase with a graduated level of risk, though, just to be candid, I think phase 1 was easily the most aggressive of those. Phase 2 was marginal, and now we're in phase 3. It's important to note that through the first 2 phases of that, we continued to see a decline in cases here in Tulsa. And what that tells me is that even when we didn't have government mandates in place on what people could do, Tulsans were still concerned in that first month alone and still vigilant enough that they were doing the right things. They were following the advice that Dr. Dart has repeatedly given about wearing a mask when you're in public, about washing your hands, about not going to work if you don't feel well, about having temperature checks in the workplace before employees show up. And because we were being smart in that first month of reopening, we saw levels that reflected that. I think the increase in numbers that you see right now is, as Dr. Dart mentioned to the City Council this morning, and I would agree with it, is that you've seen a relaxation in that vigilance by everyday people. And we have 1 million people in this metro area who are going through this reopening process every day. I think it would be a real tragedy if we ended up focusing on an event with 20,000 people that'll happen for 4 hours over the weekend and not talk about what 1 million people are doing every single day in this community. And so what I would ask Tulsans, as you see these numbers continue to increase, stop and ask yourself, when I go to the store, how many people do I see wearing a mask in the store? If you're like me, it's maybe 10 or 20% of the people in that store. Well, if Tulsans are not willing to take that kind of responsibility to protect one another, then don't be surprised when you see your numbers increase. We have a responsibility to protect each other through this, through responsible behavior in our daily lives, not pointing the finger at protests over a couple of weeks or pointing the finger at a rally that's going to occur either on Friday night or on Saturday afternoon. This is about what we do in our daily lives every day. That has a far greater impact on what we're going to see from our COVID counts in this community. Speaking of this weekend, first, I am excited for our community to celebrate Juneteenth. I think there is a greater awareness and interest in that event this year than I've seen in my lifetime, which is a wonderful thing for Tulsa. And I hope that Tulsans, if you want to go to one of these events and you feel that it's safe to go to, that you do that. If you want to celebrate digitally, I hope that you do that. But this is one of the most important days in the history of our country, and I'm so grateful that there is an increased awareness here in Tulsa of its importance and a desire to celebrate it. And I want to thank the folks who are working hard to pull together commemorations of that in our community, both on Friday but also over the weekend. And then, of course, we have the President's visit on Saturday. When we've been through what we've been through as a country through this pandemic, and you think about what cities all around America have done this year through restricting individual activity, by putting shelter-in-place orders in place, the work that local communities all over our country have done is greater than anything that I can think of that we've done. Even at the height of the Cold War, you never saw Americans across our country sheltering at home for months at a time. And so for us to have gone through that as a country, and then have the President of the United States pick this city as the city that he wants to come to highlight that we handled it the right way and that Tulsans are handling reopening the right way, I don't care if you're a Republican, a Democrat, or an independent, that's a tremendous honor for our city to be highlighted in that way. And I'm very grateful that the President would select Tulsa to highlight in that way. And so we are going to welcome the President to Tulsa this weekend. And I'm grateful that he wants to highlight our city and the hard work and the sacrifice that Tulsans have made to protect one another over the last several months. I think it is so important, though, when going back to what I said a moment ago about what we saw with our COVID numbers as we were reopening. You saw that when people did it the right way and were smart about it individually, our numbers stayed low. They continued to go down, regardless of what I told them to do or the governor told them to do. When people were vigilant and did the right things personally and protected one another, our numbers continue to stay down. Well, if you're going to go this weekend, whether you're going to the president's event, or you're going to a counter protest, or you're going to some other event this weekend, I would strongly ask you to follow Dr. Dart's advice about wearing a mask, maintaining social distancing, washing your hands. If you don't feel well, don't go. If you have a fever, don't go. If you are responsible for caring for someone with a compromised immune system, or if you yourself have a compromised immune system, don't go. Those are all individual precautions that people can take to approach not just this weekend, but everyday work and our general reopening as a state in a smart way. And speaking of this weekend, there's a lot of security precautions that are being put in place. And to speak more about those, I'd like to turn it over to our Chief of Police, Wendell Franklin.
Good afternoon. Wendell Franklin. The eyes of the world are upon us now. The eyes of the world is upon Tulsa, Oklahoma, during this event, and we are ready for it. This is nothing new for Tulsa. This is nothing new for our department. We do lots of planning and logistics for large events, and that is exactly what we're doing with this. The only difference is that we have dignitaries that will be present and a potential for a mass amount of people that probably Tulsa has never seen before. So that does lend itself to a difference from how we have normally planned. Our department has reached out and has received additional support from a number of different state and local agencies. We will increase our numbers, ramp up our numbers to ensure the safety of everyone involved in the event on Saturday. We have also worked very closely from the moment that this was announced with the Secret Service as well as our other federal partners. Tulsa is in a unique position in which we have a number of Tulsa police officers already involved in some of those other agencies, so the collaboration is nothing new. So we will continue to work with them and ensure that everything that they need to ensure this event is done properly and is safe is done. With that, the planning does continue, and there are constant changes and constant tweaks that we're making to our plan. And we will do so all the way up through Friday and potentially into Saturday just before the event starts. So Tulsans need to understand that areas around the BOK Center will be closed. I will go into greater detail as we get closer to the date, but just plan on areas around the BOK Center to be closed. Also, if you live or work in the downtown area, there are going to be significant delays in being able to get to where you're trying to get to if you are trying to maneuver throughout the downtown area. So I would encourage everyone to understand that and make the appropriate accommodations. Our goal is to keep people safe. That's what we do. That's the ultimate goal. And that is to ensure that the president and the dignitaries that are visiting our city arrive safely, make it to their event safely, and make it back to their destination back home safely. That is what we do. In the middle of that, we also want to allow people to peacefully protest, for people to have their expressions heard. We are going to ensure that those individuals have those rights. That's our constitutional right to be able to do so. And we want to make sure that that is done in a peaceful manner. We're going to maintain order throughout this, and we're also going to provide health and life-saving measures that could occur, because let's keep in mind that it's going to be 90 degrees on Saturday, and you're on concrete, so lots of buildings around, so the surface temperatures will be increased. So people need to hydrate and be prepared for hours and hours inside of a concrete jungle, if you will. Street closures. Those are going to be intermittent, and some may be stagnant. They may be closed throughout the entire day. As things get closer, we will put out that information. I would encourage anyone in Tulsa that wants to be updated on the latest information to follow our social media feeds on Facebook, Twitter, and we're pushing that information out at Tulsa Police and at City of Tulsa. Those two are your information source to get information on road closures. Our resources that we're dedicating to this are significant, and as I pointed out earlier, we have scaled up that all of those agencies that are assisting us, and that includes the Tulsa Police Department. It includes Oklahoma Highway Patrol, the Tulsa County Sheriff's Office, a number of different local area law enforcement agencies will also be involved in securing our city. We are also going to rely upon our federal partners to include the FBI and the U.S. Secret Service. We also will be utilizing the National Guard to help increase our numbers. So there will be significant presence in the downtown area and over the coming days. And to that, we will also continue to maintain the rest of the city, the other several hundred or 200 square miles within our city. Our officers will continue to provide this service that they do on a daily basis. And we plan on being professional about that and how we do that. And that will be nothing new. So keep all of that in mind as we move towards the weekend. And let's have a safe and hopefully uneventful weekend. Thank you.
Thank you, Chief Franklin, and I really hope all goes well this weekend. So I'm kind of the one who talks about Tulsa County and where we are with our response to the COVID dollars that we got from the federal government through the CARES Act. It's about $114 million. So I'm going to bring you an update on that. This morning, the Board of County Commissioners approved an agreement to work with Rose Washington. She's with the Tulsa Economic Development Corporation to administer a forgivable loan and grant program for small businesses as well as the nonprofits headquartered right here in Tulsa. The county, anybody who experienced COVID-19 related closures or interruptions. We will have a much larger announcement about that beginning next week. Last week, we announced the Safer Tulsa County program with the Tulsa Regional Chamber and the Tulsa Area Emergency Management Agency to provide free PPE kits to small businesses and nonprofits with less than 50 employees. And this was supported by a portion of the county's CARES Act funding allocation. Small businesses and nonprofits can use these kits to ease the reopening burden and focus instead on recovery and their path forward. Each PPE kit will contain a 1-month supply of items for 10 employees, including hand sanitizer, surface disinfectant, cloth and disposable face masks, and a thermometer. Employers with 5 to 10 employees can receive 1 kit. Employers with 10 to 25 employees can receive up to 2 kits, and employers with 25 to 50 can receive up to 3 kits. So visit tulsacounty.org/PPE to fill out that application form, which will be used to verify the employer's status within the Secretary of State's corporate database and with the Tulsa County Assessor's Office. Once verified, employers will be contacted with a date and time for pickup at Expo Square. Kits will be available for pickup beginning this coming Monday, June 22nd. Lastly, this coming Friday, June 19th, the courthouse and our annex, which are in the epicenter of this event, are going to be closed. Given the street closures and other security measures that will be implemented in preparation for the rally at the BOK Center and Convention Center, the BOCC decided this morning that would be the most appropriate course of action for our employees and the public we serve. We'll resume normal operating hours Monday at 8 a.m. I will also close asking that everyone please stay safe and remember to look out for yourselves and each other. And if you're attending the rally downtown or any other event, please wear your masks. And let's do our best to keep these new cases from going up any higher. So thank you very much.
All right, that concludes the news conference, and now we will be able to take questions. Do we have any for Mayor Bynum? Dr. Dart. Yep, Dr. Dart.
Hi, Dr. Dart, quick question. You have a presidential rally, you have Juneteenth events, counter protests. Based on what's going to happen this weekend, as a medical expert, are you expecting cases to spike? And do you think there will be more deaths because of this weekend?
You know, that's a possibility. And one of the things we've been saying from the very beginning, like the echo the mayor and our other speakers, that I think it's tremendous that we live in a society where people have a voice. I think it's important for people to use their voice, but we also are in a time when we're in the middle of a pandemic. And so there's danger as you do it. So if you want to use your voice, do it safely, wear your mask, social distance, because coming together is a definite possibility of seeing increased infections and increased deaths from those infections.
Dr. Dart, just to follow up his question, just based on your medical expertise, with thousands of people in this arena, most without masks, how worried are you about a dramatic spike in cases in this county?
You know, in any event with people not wearing masks, we're concerned about a spike. And
This many people, thousands of people.
We're concerned. I mean, people coming together without taking precautions is what causes the virus to transmit. It gives the virus the ability to transmit from person to person. So, of course, we're concerned. And it's a distinct possibility if people don't take the proper precautions and don't protect themselves.
Do you feel like you've been yelling at a brick wall with the positions you've taken over the past week?
You know, that's our job, to stand up and try and do the right thing. And based on what the data and the science is telling us. So we really talk about the topics based on what data and science tells us to discuss, and that's what we've been doing, and we'll never stop doing it. And it's our hope that people will continue to listen and will continue to follow recommendations. And, you know, our job is to be here when they need us, and that's never going to stop.
Is that disappointing, though? I mean, we get the thank you for your guidance and we're gonna go another direction. I mean,
You know, trust me.
looking at the wind here.
Trust me, I really get quarantine fatigue. You know, people's lives were disrupted and it were so unexpectedly and in ways that we never fathomed pre-COVID. And so I do understand that at some point you throw your hands up and you just want to live your life and not pay attention to the reality around you. But this is the reality around us, is that we have a virus that we have no or little to no immunity in the community. We have no vaccine, we have no clinical therapies. So you've got to take the only tools we have are the precautions, the recommendations we make around masking and distancing and hygiene. And do people probably get tired of hearing that? I'm sure they do. You know, but we can't stop messaging. And eventually, we hope that people will continue to listen and will start to be vigilant again. Because, as Mayor mentioned, we were flattening the curve because people were doing their part. And we're accepting their responsibility and their role, and we're wearing masks, and we're social distancing, and we're paying close attention to their hand washing and hygiene. And so they got fatigued. Well, let's step back up and let's embrace that role and that responsibility again, and let's keep doing that.
Dr. Dirk, part of the responsibility of the health department is to make recommendations. You said so yourself. Did you recommend to the city that this political rally not be held at this time?
You know, I recommended that it be postponed until it's safer, until the data tells us that it's not as large a concern to have people indoors in enclosed spaces with the threat of a COVID-19 transmission. So if we could push it back to when the data tells us safer, that was my recommendation. That's what, you know, I personally would like to see happen. It's here, so let's focus on staying safe while it's here.
What about the community afterwards? Do you think we could go back to isolation and more social distancing and closure of businesses and parks?
You know, we're going to, like we've done from the very beginning, we're going to pay close attention to what the science and the data is telling us. And if the science and data tells us that the only way that we can keep our community safe, that recommendation will be made. Now, we'll see what it tells us in a few weeks. Right now, we don't know. It's a possibility. You know, we want, like everyone in this room, we want everyone to stay safe and to not be exposed and not be infected. And if that means recommending more shelter-in-place orders, that's something that we morally have to do.
We've seen a spike in cases, but the mayor said that hospitalization rates are down. Is there a reason for that?
You know, I think, and frankly, we're really happy that hospital capacity is very strong right now, and that's, I think, a testament to their surge plans. But, you know, I think what we're seeing is that, as I mentioned in my earlier remarks, is a younger demographic is now getting sick and getting exposed, and who are healthier than what our initial demographics were that got sick, that really aren't, at this juncture, we're thinking not requiring hospitalization. So we're seeing a lot of cases. That's not transmitting to huge increase in capacity. We'd like it to stay that way.
Are you concerned that the potential rate of infection from this weekend, particularly the president's rally, could meet the threshold to be considered a super spreader?
You know, absolutely. I mean, and super spreaders, I mean, that's really, some people have the ability to spread the virus more efficiently. Large events can result in people going off to other places and spreading virus where they're at. So whenever people come together from outside and then go back, there's always a potential for a super spreading event. And some people, unfortunately, just transmit the virus more efficiently than others, which results in a super spreader in that individual. So, of course, that's a concern.
How much of our numbers going up is simply because we are testing more, or is the virus actually taking off like hotcakes?
So, and I'm sorry, I was supposed to be repeating your question, so I apologize for that. So, you know, the question was around numbers going up, and you know, we expanded testing about 3 weeks ago, like I mentioned, and actually statewide testing has even downticked a little bit, but we're just finding more positive cases, and I think that's a testament to people going out, resuming their life, but not taking the precautions that we've been recommending, so there's more exposure. So we're still testing many people, but we're finding more positive cases.
Are you worried that this could further overwhelm you all's ability to engage in contact tracing, given the number of people?
And the question was, are we concerned about being overwhelmed and really doing our job in contact tracing in case investigation? And yes, I am. I'll be honest. Our staff right now, I mean, today we reported 96 cases, which is our highest report since it started. Our staff are overwhelmed. They've been working this since mid-February, just ramping up, and then our first case was announced March 6th. They haven't had time away. I mean, and you know what it's like when you're working 7 days a week for months. I mean, if you can imagine, and how they're feeling. And plus, they care so deeply about this community and people who live here, and they want to protect everyone. And frankly, not only are they emotionally and physically starting to wear down, I think their hearts are hurting as well.
We have one more question for Dr. Dart, and we'll move on to our next speaker.
To follow up on the contact tracing, sir, just how will you trace all those who plan to attend the political rally?
How will we trace everyone who plans to attend a political rally? We only trace people who are reported to us as positive cases. And so all the reports from Tulsa County residents, we will conduct contact tracing. If there's other Oklahoma residents who are infected, the state will conduct contact tracing. If there's people outside of Oklahoma who get infected, those reports will be sent to that state, and that the contact tracing will be conducted in that state.
Do you think that will work?
That's a system that public health has been functioning under since public health and John Snow removed the pump handle during a cholera outbreak in London. So it's the tool we've got, it's the mechanism we've got. Do we want to have to do it? No. But we're ramped up, and we've got great professionals who can do it and will do it.
That's all for Dr. Dart, thank you.
Okay, next will be for Mayor Bynum.
Mayor Bynum, you got a letter from hundreds of healthcare providers asking you to do something to prevent or postpone the rally. I spoke with one of those ICU doctors here in Tulsa who broke down in tears, saying she's terrified of the rally. She's been watching people die for so long, and she knows this is going to cause more of that. Dr. Dart says it's dangerous. Dr. Fauci in Washington says it's dangerous. Frankly, why are you so sure this is okay?
Well, I want to be clear. I'm not positive that everything is safe. I'm not a public health professional. I'm not here to testify to the safety of anything. Now, you referenced a letter which I've not received, so I couldn't tell you what my response is to the letter because I haven't seen it. What I have done is, and Dr. Dart referenced the conversation that we had over the weekend, and I've had conversations with ASM, the company that operates the BOK Center, had conversations with the state of Oklahoma, State Department of Health, about this. And the reality is that Oklahoma, for the last month and a half, has been operating under a reopening plan. And this event, and when ASM entered into their contract with the Trump campaign, they provided them with the state's reopening plan. We told them you have to comply with this. That's, I believe, why they're doing temperature checks for everyone before they're allowed to enter the building. That's why they're providing masks for everyone, why they have hand sanitizer available. What I don't think that we can do is say, as a state, for 6 weeks, we're going to follow this reopening plan, and then say, oh, wait, President Trump's coming to town, we're going to change the plan on the fly. I wouldn't support doing that regardless of who the candidate was coming to town. I'm answering a question. Hold on a sec. I completely understand the concern people have if folks show up at this event and aren't smart about it. I mean, that was my point earlier. We demonstrated as a state in the first month of our reopening that if people are diligent and they utilize the safety precautions that are available to them, that they can do it safely. But the question will be this weekend, when everybody that shows up at this event is given a mask and is given a temperature check and has access to hand sanitizer, will they be safe about it or not? And that is on every individual that goes about it. No different, by the way, than the hundreds of thousands of people that go to work in buildings all around this community every day.
Mayor,
Yeah.
Dr. Dart just said that he recommended that an event like this be postponed to a time when it's safer. Why didn't you accept that recommendation?
It's not my decision to make. It's ASM, under their contract with the city, has sole discretion on bookings at the BOK Center.
So you can't say there's a public health danger.
I've-
Dr. Dart can't say that and stop him.
What I told ASM over the weekend and their management was, you need to operate this safely, and whatever decision you make, we'll have your back. But that it's their decision. Under their contract with the city, it is their decision. They have sole authority for making the decisions on bookings in that facility.
Mayor, you've been on the front line of COVID, you've been trying to deal with race relations. You're also a Republican and the elected leader of this city. Where are you going to be Saturday?
I'm going to be out with our police officers who've been working their tails off for the last 3 months to keep this city safe. I'm not going to the rally. I cannot imagine what our police officers have gone through on the front lines of this pandemic, searching for those kids, dealing with the protests that have been held over the last several weeks, and now doing round-the-clock preparation for this event. So I want to be out with them, and that's where I'll be on Saturday.
You've greeted the plane before. Are you planning on at least greeting the plane?
Oh, absolutely. I think, I thought one of the most embarrassing moments for me as an Oklahoman was when President Obama came to our state, and the highest ranking state official that showed up to greet him was the mayor of Oklahoma City. No one else in the state government showed up to greet the President of the United States. I may be old-fashioned, but I think when the President of the United States comes to your town, regardless of the politics, the mayor shows up to greet him. I've talked with several of my predecessors here in Tulsa who have greeted the president, and even when they didn't agree with their politics, they showed up. And I absolutely plan to be there at the airport on Saturday to greet the president, and then I'll be back out with the cops.
Mayor, I know that there's
You said yesterday that you would have loved some other city to have proven the safety of such an event. You also said you share anxiety about a full house at the BOK Center, of course. Today you called it a tremendous honor.
Mm-hmm.
So what's happened in the past 24 hours?
Well, I think you can be honored by the fact that the President of the United States would single out your...
Different depictions. One is a concern for this community. The other is saying you're welcoming what is an honor given to you. Which is it?
It's not an either or. You can be honored that the President of the United States would single out your city. I know, you're from CNN. There are some cities around this country that the president comes to their town all the time. I think the last time we had a sitting president come to Tulsa was George H.W. Bush over 20 years ago. And so the fact that this president, coming out of this event, would single out our city and say, that's a city that did it the right way, that's a city that's reopening the right way, and want to come here, I do take as an honor. Now, does that mean that it comes without concern? No. I think any rational person looking at any large grouping of people, which is what we've been telling Tulsans for the last several months that you need to be concerned about, would have concerns about this weekend. And that's not just this rally, that's any gathering that's going to occur this weekend.
Between depicting it one day and saying that you would like to see another city first, and then today classifying it as an honor.
Well, I think throughout this event, what you've had is this tension between individual liberty and public health, and the natural tension and tug between those two things. And so as Oklahoma, as a state, based on the governor's decisions, has been really one of the leading states in the country to reopen. We're doing a lot of things that we're not seeing other states or cities do. And so for me as a person and as a leader, do I usually like to see other people try something out first? Of course. And so that was the purpose of my comment in my post yesterday was, yes, I would love for some other city to have tried this out first, and we could model what we're going to do after what they did. That's exactly how we managed our ramp up during the pandemic. But the president chose this city, and so it falls on us to set that moving forward. And it is an honor. I know there was a question over here.
So what about, even though there is a waiver being signed, it still was built with taxpayer money, the BOK Center. Is there still any liability to the community and the taxpayers post-event if something traumatic were to happen as a result of pandemic spread?
No, the city has been indemnified in that.
Mayor Bowden, we saw rallies a few weeks ago, and there wasn't as much concern over the spread of COVID, and there was some of the numbers go up. Now there's all this concern being addressed. You know why that is now that the president's coming?
Again, as I said earlier, I really think that the key behind our rising numbers is not that, you had 1,000 people on Brookside 2 weeks ago having a protest. It's that you have 1 million people in a metro area, a great many of them, including, I would say, plenty of friends of mine who've become relaxed and aren't being as vigilant as we as a community were a month ago. I mean, I wear a mask everywhere I go in public, and I'm usually one of the few people in those public spaces that has one on. If for some reason, wearing a mask has become this politically divisive issue when it shouldn't be. It's a public health issue. And so that, I think, that the ease in vigilance that's occurred around individual responsibility to keep one another safe in this is what accounts for a lot of the increases that we've seen.
One more question?
What's the status on the Greenwood visit? The governor said, no, President Trump won't be there, but Mike Pence maybe. We heard from business owners who said, doesn't matter who walks with you to Greenwood, they're going to shut the door, close the blinds, turn the lights off.
I've not heard anything one way or the other on the president's plans as it relates to any visits around town.
Can you clarify or better explain the city's authority or ability to step in if, for example, the venue, BOK, is operating this contrary to CDC guidance or Dr. Dart's recommendations?
So we have the state of Oklahoma as the opening up, the reopening plan, the hours plan that they have in place. And under that plan, the operators of facilities are responsible for compliance in that plan. Well, in our case, the city government does not operate the BOK Center. We own it, but through a contract, ever since it's been in existence, it's been operated first by a company called SMG that recently merged and is now called ASM. So ASM operates that. ASM has the responsibility to operate it in compliance with the state guidelines, and ASM provided those guidelines to the campaign, they assured me, when they were working out the contract for this event.
All right,
Okay.
do we have any questions for Chief Franklin?
Yes.
Okay, Chief.
Chief, how are you handling double duty of both this event and Juneteenth? Have you pretty much told everybody who's off to come in, or I mean, I imagine 2 special events.
Yes, I've told you we have used our resources and have merged our forces with some of the other outlying law enforcement agencies to help our department ensure that the public is safe.
Chief Franklin, even before the rally was announced, there were major national controversies involving TPD. Travis Yates' comments, the video of the 2 children being handcuffed for allegedly jaywalking. A number of elected officials locally and community leaders have wondered why it took so long until today for there to be a press conference. Do you have any response?
I don't know what you're talking about. What a press conference for what?
People were calling about those were national controversies where people all around the country and the world were talking about Tulsa. They were showing on CNN, on ABC News, and there was no press conference here locally.
Yeah, the Tulsa Police Department released a statement, and that was our media release, and that was done.
Do we have any COVID or trolley?
We've seen businesses like Quick Trip announce they're going to close some stores down because of this weekend and board up. Have you had any businesses request extra assistance to help out protect their businesses in case something does turn negative here?
No, we've had businesses want to know what the street closures are going to be, and we are doing the best that we can to ensure that businesses that need to operate and remain open have an avenue to be able to do that. And so we've worked through and are working with a number of different businesses in the area to ensure that their business is not is the least amount impacted.
Yeah, will there be designated demonstration areas downtown around the BOK for different groups?
Plans are still being drawn up, but there will be sterile areas within the surrounding area of the BOK.
Obviously, there are parking structures built around the arena for the arena. Are those parking structures going to be allowed for cars to at least park, or do I need to plan on parking blocks away and walking?
I would say that you would need to plan on parking blocks away and walking.
Once the BOK Center and the Cox Center fill up, if there are hundreds of thousands of people, is there a plan on where you're going to direct them who wanted to come to the rally but couldn't get in?
Yes, there are plans in place to ensure that that everyone can gather, and if they choose to gather and can't get inside of the venue, then there are designated areas for that.
Chief, do you have any idea of an estimated number of people you anticipate for the events of Saturday?
For Saturday's event, we don't know. We have no idea to actually put a hard number on it. We know that we've heard the number of 100,000. That's a number thrown out there.
What kind of guidance can you give people camping out? Because it is first come, first served to get in. We've already got people camping out. What kind of guidance can you give? Is it okay to be on the sidewalk? Does it violate a city ordinance to bring a tent? Or can I wait like a regular concert?
Well, you can wait like a regular concert, but my guidance would be to hydrate well and hope you're sleeping well.
The mayor calls this an honor to have the president here. Is it an honor for your department to be able to help with an event like this and help keep the president safe?
Most definitely, it is an honor to have the president and his vice president and those come to our city. So we are going to welcome them with open arms and provide professional service to them and to all of our citizens.
Do you know how many accumulated law enforcers there will be? Do you have a number for how many there will be?
No, I don't have a number.
You know what the cost is looking like right now to host the president and secure this area?
No, I don't have a cost.
Chief, what do you say to those who believe that the president coming might be racially insensitive and they're upset and they want to cause trouble? What would you say to them?
I'm the chief of police for the Tulsa Police Department, and I protect every citizen. I don't care what color you look like. I don't care your political affiliation, sexual preference. I don't care. We're going to protect all of the people that come to our city and do that in a professional way.
One more question. Can you explain why y'all are including the National Guard as part of y'all's efforts for security, given in the past few weeks tension that we've seen whenever the Guard comes out for demonstrations that obviously have a different message than what's happening Saturday?
Well, there was no tension when the National Guard came out. The civil unrest began before the National Guard was deployed. So to say that the National Guard is inciting something is kind of absurd, in my opinion. Again, we're going to use them as a force multiplier to help assist us in ramping up our numbers and securing a safety area for our city and our citizens. That's one of the things that they do. That's part of their job.
Okay, thank you, Chief. And I think Commissioner Keith, you have a couple questions.
Commissioner, with y'all closing the courthouses, everybody talking about boarding up. I mean, we've got some glass areas. Some of the downtown businesses are boarding up just in case.
We have not discussed boarding up, but we met this morning to just talk about protocols, but we have not talked about that. And I hope it doesn't come to that. I hope there's no destruction downtown. And I do want to be clear about a couple of things. We're not talking about 20,000 people in the arena. 20,000 people in the arena, 45,000 on the street between, and this is if we get the 100,000 figure, and the rest in our convention center. So it is a big undertaking for this community, and that is our best guess at 100,000 people. And I must say this too. Earlier, I'm speaking as a member of the Board of County Commissioners, and what I'm saying in the Q&A is me as a singularly elected county commissioner.
As the singularly elected county commissioner, you've been pretty vocal on Facebook about this.
I have.
Do you still stand by what you said about this isn't proper?
No, I wish it was at any other time. We are a welcoming city. And in fact, if I could take President and Pence both on a tour of our levee system. So for those of you who are not from here, we have a levee system that is in dire straits. And last year at this time, we were fighting flooding, and the mayor and I were side by side just trying to keep that levee together with the National Guard and the Corps of Engineers, so it was essential. And Vice President Pence went out into one of the flooded neighborhoods, and I had the honor of taking him on a tour of that area. So, but I would love to do that for both the President and Vice President, because we are in line to get some federal funds to get that levee fixed. And so we're waiting on those funds. So I would jump at that opportunity. In fact, I let the governor's office know that if the Greenwood tour couldn't happen, I'd be happy to do that.
Ma'am, are you worried that the elected officials of this county, of this city, may be letting down the people of this city when it comes to their safety? And this event, which is not a required event, not mandatory, it doesn't have to happen.
I agree with you completely. I think that we should have done any and everything that we could to move this to some other time, because as you all heard, our numbers are spiking. This could be a super spreader. You could see our numbers go up. Our hospitals are doing great, and I'm so glad that we have the capacity that we have. But given 2 weeks after this event, I can promise you that we are going to see issues in this community. And I went down there yesterday and really enjoyed meeting some of the folks who were lined up out front. So just, we don't know where everybody's coming from. We don't know if they're coming from a hot spot. Who are they? So I'll just go through this a little bit with you. But the first people in line were so excited. There's a Mike from Evansville, Indiana. It's his 10th rally. He's so happy to be here. And they were really sweet. Rick from Ohio, his 21st. A New York City guy who's here writing a book about the rally itself. And another guy from Ohio, and another guy who I think was probably in our homeless population, but he was joining them. And Robin Stites, who's from Sallisaw, this is her second rally, and she met Rick and James in Lexington, and they are now a Trump family. But, I mean, they were really, really sweet, and I went down there to welcome them to our city. I mean, we love to welcome people to our community. But that's just a snapshot, a thumbnail sketch of people who are coming from all over to our community. And we can't control that. So where have they been? Are they in a hot spot? We can't control that.
Same question I asked Mayor Bynum, except that obviously the logistics are changing. You're a Democrat, you're an elected leader of this county.
Mm-hmm.
Where will you be on Saturday? Do you greet the plane at least?
Well, I haven't been invited to greet the plane. So, but if Mayor Bynum or the governor asked me to do that, I would do that. Absolutely. I remember when our governor failed to go meet President Obama. It was very embarrassing, just as the mayor said. So, I would absolutely go out there, and I will volunteer to take them on a tour of our levee system. I would love to do that.
One more question? Okay. Thank you all.
Thank you all.